Hi, I'm Anatte Karmon.
Good morning or good afternoon, John Frattarelli.
We're both physicians at the Fertility Institute of Hawaii. We'd also like to introduce you to Dr. Carrie Eichberg.
Hi.
Hi.
Carrie, thank you for joining us.
Of course, my pleasure.
So today we're going to be going through a Facebook Live session regarding the emotional impact of infertility. And we're so lucky to have Dr. Carrie Eichberg joining us. She is a reproductive psychologist and the author of Building My Family, A Story of Egg Donation and Surrogacy. She really is a specialist in this field. We work with her closely for our patients as well as for our egg donors, gestational carriers, etc. And we really want to hear what she has to say regarding fertility and the emotional impact of it on mental health. So I don't know if you wanted to get started.
So, Carrie, obviously, infertility or fertility treatments, they're psychologically very, very difficult for patients. Can you kind of talk us through what the psychological impact of infertility or infertility treatments are?
Sure. I think the first thing to realize is that infertility or fertility problems, it is an extremely distressing life crisis for people. And a lot of times couples have never experienced something to this degree before. And it can evoke a lot of feelings of loss. And there's so many decisions to be made. And some of the common feelings that go along with infertility are depression, anxiety, feeling out of control, feeling isolated. And all of those feelings are really normal and can be part of the process. And it really is normal to have ups and downs throughout it. I think that we've seen there was a study done where they measured the level of stress of infertility patients and compared it to other conditions, and it's equivalent to a cardiac illness and cancer and things like that. So it really packs, unfortunately, a tough punch that people can experience. However, I think one of the first steps in realizing how to deal with that is to recognize that infertility really is a medical problem, and that you can't make yourself produce quality eggs, and that you can't make yourself produce a certain number of sperm. It's all these things are out of your control. And the good news is with infertility that it is completely treatable. It is completely treatable. I think it just depends how far you want to go with it. And it might not happen in the exact way that you thought, but it is something that Dr. Frattarelli and Dr. Karmon can certainly help you move through. So, what's the next question?
Yes, can I follow up with that a little bit? So I think people know my fertility journey. We were at the point where I was really done. Didn't think it was going to work, and my wife wanted to do one more cycle, and magic happened. And so I think one of the things that people, I guess everyone, including myself, sometimes we kind of think that all of the stress and all of the psychological impact is on the female, but it's really not. The male is impacted too. Can you talk about that a little bit?
Sure. Men and women have equal levels of distress in going through that, but how they experience it or talk about it, it can be very different. Women often experience a lot of emotional distress and need to talk about it, and it affects their self-esteem. And men tend to want to fix it. And some of these things are unfixable without help. So we have that different dynamic. And if each part of the couple is not understanding the other, it can create problems. So.
Yeah, and I think just a comment about what you said before about recognizing it as a medical problem. I oftentimes will, that's one of the first things that I discuss with patients. A lot of patients come to me and they just say, I don't understand why this isn't happening. This is creating so much stress in our lives. How, and I just say you have to think of this as any other medical problem where we have to kind of undergo some tests and then look at the best treatment options for you. So I think that first step is really a huge step in your overall mental health, it would seem to me.
I ask some of the folks that come to see me struggling with infertility, like, what advice have you gotten? And some of the things that they've been told are, why don't you just adopt? You just need to go on vacation. You just need to relax. Or what's the big deal? You already have a child. And you're young, you have plenty of time to get pregnant. They've heard it all. And I think those comments are, people are trying to help, but it's uninformed. And I think what people need to understand too is that there is no rigorous relationship between stress causing infertility. Now, it may make you feel terrible, and we can talk about ways to deal with that, but you don't have to worry that stress is going to cause your infertility, and that we really don't see an impact on pregnancy rates according to a certain body of research.
So telling patients to go on vacation, so I need to stop doing that.
Yeah, you need to stop doing that.
And just, you must be doing something wrong.
Exactly.
So tell us then about, coping mechanisms. Obviously, infertility does cause a lot of stress. Even if stress doesn't cause infertility, it obviously works the other way around.
Yeah.
What are some of the coping mechanisms? How can they deal with that?
Sure. I think the first step is to really accept your emotions and understand that there's no right or wrong way to experience infertility. Some people might feel hopeless. Some people might feel angry or have despair, think it will never work. And I think that just understanding what you're feeling is the first step into developing even more coping strategies. And one of the most damaging ones, I think, that we need to avoid is to avoid any kind of guilt, that this isn't anybody's fault. And just like, if you come down with cancer, that's not someone's fault. So we need to look at infertility as something, as I said before, to be able to get that you can treat. But thinking about it as and personalizing it just doesn't really help. And then I think one of the other things you can do is oftentimes if people are invited to baby showers or family events, those things, people don't know what to do about that. They feel guilty about not going. They feel terrible about being angry and that they don't want to go. But you need to figure out a strategy for that. And I usually will tell people it is absolutely fine if you don't go to a baby shower. In fact, maybe you shouldn't go to the baby shower. Write a note, send a lovely gift, and just say you can't attend. And I think it's important to be able to protect your own emotions and to not engage in something that might be very hurtful. You don't have to go. Also, if you're able to maintain your physical well-being by exercise, by eating well, that certainly helps. One of the things that actually overlaps with COVID right now in terms of coping is doing something for someone else. If you can engage in some volunteer activities, If you can reach out to someone who might be in need, that's another way of kind of coping with some of this distress. Also, everyone who has infertility has questions that are they don't know how to answer. Like, when are you going to have a baby? Or, how come you haven't knocked her up yet? Or, all these questions. And having a joint way of answering these and something that's planned out is going to be really helpful because you're going to know what to say. And sometimes you can say, we're working on it, or I'm just not comfortable discussing that, or I'm not sure, how are you doing? And direct it back to them. So those are some ways to kind of be prepared for those questions so they don't overwhelm you when they happen. And not only, I think it's important to understand your emotions, but also to be able to communicate your emotions to your partner. So know that whatever you're feeling is okay, but it's important to talk about it. But at the same time, the way we manage this is because stereotypically women want to talk about it more and talk about it a lot and talk about their feelings, and it can overwhelm men. So who feel paralyzed to, as I said, to fix it. So put a timeline on it. Like, we're going to talk about this for 20 minutes to half an hour each day and listen, but it allows the partner who likes to communicate, knowing that they have time to do it, and the partner that doesn't like to talk about it as much or feels overwhelmed by it, to put some time limits on it.
Yeah, I think John is feeling kind of overwhelmed right now.
Yeah, and I think that's great advice. The problem is that it needs to be told to couples initially, rather than hey, this is going to be this may be an issue for you guys. You guys need to be able to take some time and talk about it, but set limits, and because it's difficult for couples to do that in the heat of battle, basically, right, when things aren't going right.
And obviously, as physicians in our office with patients, we have a lot of material to cover. We have to, discuss their testing results. We have to go through treatment plans with them. Do you think we should really be making this a priority? I mean, I think I know your answer, but I'll ask it anyway. Do you think that we should be? I mean, I think I need to be at least doing a better job of bringing this up and talking about these communication strategies ahead of time when I have both of these patients in the office. Is that something you think that the physicians should be introducing, and how would you suggest we work that into our consult?
I think it's really difficult. And this is where our roles come in, because you guys have so much medical information to give to people and the time. So yes, to have a sketch, but be able to refer to a psychologist or a mental health professional in reproductive medicine that really understands the issues. Because I understand, pressed for time and the breadth of things you need to cover. So.
Right.
And, I think it's important, and maybe you can correct me because I'm not a psychologist. I think it's important to take control of your life. And part of that, like you just mentioned, was, diet, exercise routine, to having a routine. What about other things like yoga, meditation, acupuncture, things like that?
All those things I think are really important ways to cope with the stress of infertility. And I think you touched on one of the key parts in making it through is that you need to be able to control what you can. And that actually goes for what's going on for infertility and for COVID. So the things that you can control are communicating as a couple. And also having a joint coping strategy. For example, there's so many times when only one partner is going to the appointments, where if you make it that both partners go to the appointments, it's a joint way of coping with it. And also, in terms of taking control of who does what. For example, if one person makes the appointments, the other person deals with the insurance. And there's a lot of things that you can control in your life, like making reservations to go to dinner. Not now, but maybe at a future time, or picking up a nice meal. Focus on the things that you can control that help you build your relationship.
Do you know of any like apps or online? I mean, everyone's on their phone. Everyone's on their.
Yeah.
Are there like apps or anything that can help people with, helping with stress or, coping?
I have a favorite, and it's called Ferticalm and Fertistrong. And that one is built by a colleague of mine. A few of them, I believe. And I really love that app. It has all different kinds of ways to handle bad news, or to what to do when you're feeling down, what to do when you're feeling anxious. And the Fertistrong one is for men, and Ferticalm is for both. So.
Yeah, we actually do utilize those sometimes as well.
And then what about, I think we were talking earlier and you mentioned potentially having meetings and talking to others with fertility issues. Is that something that patients can also do online? Is that, can you talk about that a little bit?
Sure. I think some people like to be part of like a group, and some people don't. But it is important, even if you're someone that doesn't like to participate in support groups or something like that, that you find at least one person who, even if they haven't experienced infertility, that they are supportive and can understand and are non-judgmental. But if you can find someone who has, and there are many people out there, including myself, who have been through infertility, I think people find that it's a unique group. While all their friends are getting pregnant and celebrating, they're at the opposite end of feeling hopeless. So finding people who can also relate to your feelings, I think, is really important part of it. And there's the group is called Resolve. I know you guys work with them a lot, and recommend that group. And they are the infertility. It's a nonprofit that has all kinds of information and support through it, and local groups for infertility support. And of course, if you need more support, if you're finding that you are continuously down, if you are struggling in your relationship, if you cannot stop thinking about infertility, if you've had losses, we recommend that you reach out to a mental health professional. We can be helpful in helping people cope with some of those decisions and, disappointments.
That was actually one of the questions I have for you. When should people seek professional help? One of the concerns, but one of the difficulties, though, sometimes I have somebody sitting across from me, and I can tell that she or he are that they're very emotionally distraught, and this is very upsetting for them and very stressful for them, and I will recommend that maybe they talk to somebody who's better at talking and listening than I may be, and they always say no. How do I manage that?
I think the best thing you can do is to normalize it and just say that your feelings are normal going through this, and that you don't have to be crazy to go see a psychologist, and that it really can be helpful because you don't want to be miserable going through all this. It's so stressful. Can we at least turn down some of the negative emotions that you're feeling? and help you get through. But yeah, I think that would be my best advice.
I just wanted to switch gears a little bit because I really do want to hear about how infertility affects couples. Obviously, this is, I think we all know that this can put a huge strain on partnerships. And
Sure.
to kind of hear from you about that.
Well, I think it does put a strain on partnerships, but I think you have two choices. You can either turn away from each other or you can turn towards each other. And like with a lot of crises in life, you can become stronger and closer from it, or you can let it tear you apart. And it takes active effort, I think, to work together and move through it. I think initially, well, throughout the whole process, intimacy is a big issue because what I call when other people don't have infertility can have a baby the cheap, easy, fun way, you cannot. And that really intimacy and sex is now linked with failure. And so to be able to untangle that takes some work. And setting aside times where you are not in a fertile period, where you can go out to dinner and enjoy each other while you're not trying to have a baby. So that's one way. And I think that, the other thing we talked about is the gender differences and that how folks communicate. And that can really put people at odds, but recognizing that that feelings are just feelings. They don't have, they're not bad or good. They just are. And allowing each other to kind of talk about that, about what they're experiencing in a non-judgmental way, because not everybody copes the same way. The way that, whether you're a heterosexual couple or whether you're a same-sex couple, not everybody copes the same way, and making room for the other person is really important.
Right. So I think a lot of us are obviously having a lot of extra stress, and patient, so patients are dealing with the stress of infertility. They're also dealing with some of their treatments being delayed, although hopefully that's kind of starting up again. And but the stress of the COVID-19 pandemic has put an extra layer of stress on patients already undergoing infertility or thinking about infertility therapy. What advice do you have for coping with the stress of the pandemic?
Well, and I would add not only coping with like the infertility part, not needing to, like if they're cycling, needing to wait, but then when they're ready, like right now we're able to start helping patients, but now there's the psychological stress of what if I'm pregnant and COVID, is an issue.
Sure. I think it's really important, even thinking about COVID and the effect on pregnancy, is to listen to you guys. I know there's limited data, but there is some out there. And, being able to listen and apply that to your thinking. So do you want to comment on that briefly, and then I can kind of move forward about what we know?
Sure. Well, as far as, I guess the biggest, thing out there is, what's it going to be like in 6 months or a year,
Right.
And, there's lots of theories, and I think the most prevalent one right now is, COVID's going to be around. And it's going to be around for a long time. The question is, how severe is it going to be? Are we going to have a vaccine? Are we going to have treatments? Is it going to be more like the flu, and that it's going to be a yearly thing? We just don't know, but it's right there, and it's going to be there. And the unknown, I think, is the biggest issue for that. And then as far as pregnancy goes, it's new, right? It's a new virus. We have We have a lot of data, but we don't have really any data because it's all new. And so the data would suggest that in pregnancy, pregnant patients aren't more affected than non-pregnant patients. But like any pregnancy, if you get sick, there choose with the pregnancy, and the preterm labor, preterm delivery seem to be a risk depending on which trimester you get it. It doesn't seem that it affects the fetus at all, like Zika, where you don't necessarily have fetal malformations or anything. But it's still, I think the biggest thing is it's just all of a sudden dropped in our lap, and it's an unknown, and that causes a lot of stress for people.
Right. And I think we have to accept that it's unknown. And there's lots of things in life that we don't know and that we can't control. So getting back, this is where it parallels with infertility again, which is that control what you can. You're going to take advice from your doctors to move forward now or not, and what types of treatment. You're going to protect yourself as best you can from that, but we can't control everything. And I would say regarding infertility treatment and COVID, my biggest worry actually is people who are doing international surrogacy. And that what we've seen is that we don't know about the travel bans. So if someone is delivering a baby, the surrogate is delivering a baby, and intended parents can't get here, that's a problem. And so I think people need to think very carefully about their steps in doing that and how they might mitigate that. And I don't think it's enough to just have somebody will take care of the baby for a little while, because from a psychological perspective, we're really looking at bonding, and we want the intended parents to be bonding with that baby immediately. So to me, that the travel restrictions have been, I think, something that is just really unknown that we don't know. So, but at the same time, if you're doing a surrogacy, you won't probably have a baby for 18 to 24 months. So I find it really hard to believe. I really hope we don't have travel restrictions in 18 to 24 months. It's just something I think to be really aware of.
But the people who are doing international surrogacy a year ago now are dealing with what you're talking about, where the child's being born and they may not be able to be there.
Right.
Yeah, that's a huge issue, and they couldn't have predicted that. Of course, that's
no, they could not have predicted that, and they're finding very good options to deal with it, but I know it's been a struggle. So yeah. But in terms of, we sort of got on this in terms of COVID and coping, I think the most important thing is to have a routine. And so you cannot to have your days just become all mush together. There has to be work days and, days for the weekend, whatever days those are for you. And there has to be individual time and family time. And doing the things that you would maintain when it wasn't COVID-19. So if you get up and shower every morning, make your bed, do the things that create routine for you versus staying in your pajamas for 3 days at a time, it's a recipe for mental health issues, I think. There's just no delineage and no routine. So
I would agree. And I have, we do telemedicine consults with, patients these days. And so, I do notice that, sometimes it's 1 o'clock in the afternoon and people are still in bed. And I haven't necessarily thought about, okay, is that affecting their mental, their state, or they're more depressed? I haven't necessarily put that together, but that's something I'll start thinking about, and maybe asking some questions when I see that.
Yeah, it's tough to have no structure at all. You know, we sort of live by structure and what our days look like and feeling productive in whatever way, whether you're caring for kids at home or whether you're working. You know, having some purpose in life is really important.
Yeah. And so I know that we did touch on this a little bit. I just wanted to again delineate the resources that are available for patients to deal with emotional aspects of infertility. You mentioned ASRM, Resolve.
Yeah. And those are all great options. And there's also something that I came across. It's by Dr. Russ Harris. It's called, and he's author of a book called The Happiness Trap. And he did a whole online presentation for how to deal with COVID. And I thought it was great. So it's a plug for Dr. Harris, but it's called Face COVID, FACE COVID. And it has a lot of different ways to manage anxiety and stress during this time.
Perfect.
Okay, yeah, we'll be watching that ASAP.
Thank you.
All right, thank you. And then, is there anything else that you think we really need to cover regarding mental health, infertility, COVID?
I think it's important to know when to reach out for help. And I talked a little bit about that, but really if people are feeling, you know, at all like they can't concentrate, there's been a change in the way their eating habits, if there's been a change in their alcohol use, then I think it's really important to be able to reach out for help. If you're feeling like you just can't cope, those are all one of many things to look for, you know, if you're really struggling, and to please reach out.
I think these days there's so much out there, or again, you know, in on the internet and different apps and everything. But you're right. If that's still not working, then you got to go back to the tried and true method, which is, you know, talking to a professional.
And I think because sometimes people are hesitant to come talk to us, you guys end up being the therapist.
Yes, this is true. Yeah, and so, but I do want to stress for our patients who are watching this, or fertility patients in general, you know, you should definitely bring up to your physician if you're feeling really hopeless and feel that it would be a benefit for you to talk to somebody, because we can help make the appropriate referrals. And, you know, not everybody may feel comfortable even discussing that with their physician, but I think they should be aware, all of you guys who are watching should be aware that we're really used to this. We're very comfortable in talking to you, but also making those referrals as needed.
I think one of the things that seems really obvious right now, because everybody is connecting on Zoom. Look at us, we're connecting via teleconference, but is to stay connected with your friends and family. I think this is a particularly difficult time if you live alone and you're socially distancing, that have those Zoom conferences, you know, make regular get-togethers and so forth, because humans need connection. And that's one of the ways that I think can inoculate you a little bit against depression. So don't be afraid to reach out.
And also, I think, you know, with, you know, what we're doing now, you know, with telemedicine, it makes it very easy. I mean, they can talk to you or someone else, just, you know, with video conference, as
yes,
you know, going into the office potentially.
I mean, I think all psychologists and mental health professionals, and probably doctors too, prefer in person. But we are where we are. And in my practice, and I would say everyone in my building who's doing therapy, we are all doing it via telehealth because we want to be able to do it as safely as we can. The only reason you would have to have a really valid reason to come in for in-person at this time. We hope it changes in the future, though.
Right. Yeah, and again, for our patients in Hawaii, they're depending on the insurance plans that you have, you may likely have benefits for forced counseling. And there are many patients who choose to pay out of pocket for counseling as well. So that's, again, just something to bring up to us so we can help make those referrals for you.
And maybe you know about this, but I did read that somewhere that certain insurance companies are waiving copays for mental health. So that's something also to look into. I can't say exactly which ones, but I think people are trying to make it easier.
So the Hawaii-based ones are waiving it not only for mental health, but for all telemedicine.
They are.
Telemedicine is being, the co-payments are being waived. We don't know how long that's going to be in effect for, but as of now, that's understanding.
Right.
It's a good incentive.
Right, it is.
Yeah.
Yeah. What other questions do you guys come across regarding mental health, or the concerns that you see that maybe I could answer? Is there anything that I left out?
Well, I just want to make one comment because somebody watching just made a comment that online support groups are amazing. So I know that there are lots of Facebook groups, and things like that. As physicians, we get sometimes, they make us a little crazy, right? Because people, unfortunately, there is some false information that is kind of being spread on some of those groups online. But I think in terms of emotional support and connections and making yourself as aware as you can, I think that social media online support groups can be really great for that. I don't know if Carrie, if you agree or have any suggestions.
Oh, absolutely. I think you just have to be, some people are comfortable with it and some people aren't. And if that's one that is a great outlet for you, wonderful. I think the one part I think in our talk today that I think I may have left out is that one of the major decision points in infertility is when people are making a decision about using third party. And by that, we mean donors, we mean surrogates, we mean egg donors. And that can really be a time when you might want to reach out to a professional who, a mental health professional who's really skilled in reproductive psychology, because there are lots of different feelings and thoughts and things to think about that we can be helpful with in those points of the treatment. So.
Yes, we agree.
Yeah, absolutely. Well, I think that's kind of what I had for you. It definitely is above and beyond what I've expected. So thank you so much for joining us. Somebody was asking a question.
Thank you, Carrie. Yeah, we might have one.
Well, let's see here. So, okay, so yeah, we did touch on this a little bit, but I'll just read you this question here. I don't know if Carrie, if you can see the questions, but
I can't right now.
Okay, yeah. So someone's saying, I feel like eventually a lot of infertility patients feel hopeless. How would you know if your feeling of hopelessness is one that needs professional mental health or something you can handle on your own? That's a really great question. So as a patient, how do you know when you should really be reaching out to a professional?
I think if that hopeless feeling doesn't go away or extends a long period of time, that's when you really need to reach out. And reaching out doesn't necessarily mean that you're going to be in therapy for the next year. You can just go for a few times and see if that's helpful to you and give it a try. But I wouldn't want someone to be experiencing that negative of a feeling all day, every day for weeks at a time. So I think that's intensity and length of time. Yeah.
And then also, I think, again, I'm not a psychologist, but if it's impacting your daily life in terms of tasks, right? So difficulty with concentration, changes in your sleep pattern, changes in your appetite or weight, right? I mean, those are some of the things that you need to really look out for as well.
Affecting other family members, your friends.
And of course, any feelings of suicidality or feelings that you might hurt yourself, that isn't a time to immediately reach out. And usually if people are voicing that or have those feelings, they've had them for some time before they actually talk about them. So it would be very important to reach out to somebody in the mental health field if any of those feelings are coming up.
Okay. All right.
Well, thank you, Carrie.
Thank you so much.
This has been great. Thank you.
You're welcome. I just would like to say, if we can close it out by what I started in the beginning, which is that please remember fertility is treatable, and the doctors here can help you. And again, it may not be exactly the way you thought, but it is treatable.
Thank you, Carrie. I agree. Well, come see us for treatment.
Okay. Bye.
Carrie.
Bye, Carrie. Aloha.